Hello, everyone, and thank you for joining us today. Welcome to the American Medical Association's Private Practice Simple Solutions, part of the Steps Forward Innovation Academy. Before we get started with the content, a quick few housekeeping items. The Private Practice Simple Solutions program is a series of rapid learning cycles designed to provide opportunities to implement actionable changes that can immediately increase efficiency. Please note that this presentation has been recorded and is for informational purposes only. You should consult a professional advisor for specific medical, legal, financial, or other advice. Please take a moment to carefully review this notice. I'd like to now introduce today's speakers from Springboard Brand and Creative Strategy, Rob Rosenberg, President, and Mike Chapman, Senior Vice President. Go ahead and take it away, Rob.
Great. Thank you so much, Symbol. Well, when we talk about maximizing physician referral strategies, there's certainly a lot of content that we want to chat about today. First, we want to talk about the importance of maximizing your physician referral strategies, why it's important to really understand where they stem from and how essentially you can best optimize these strategies. Manage the referral continuum, maintain strong relationships. We'll talk a lot about customer service today. We'll talk about patient-centric referral strategy, why it's important to keep the patient front and center, and essentially being transparent with them about your referral strategies, especially today's healthcare consumer. We'll talk customer service strategies, as I referenced. It's important to have important and online referral strategies to essentially showcase your expertise and thought leadership. And again, other sources for professional referrals that come from outside physician practices can also be an advantage for your practice. On the next slide, let's talk about the importance of maximizing your referral strategies, which are really key for all physician practices. For primary care physicians, it's important to know who and where and when to refer your patients for specialty care. Keeping a reference sheet that you, again, understand who in your area is best to refer your practice, your patient is going to be certainly very paramount. For specialists, knowing the right targeting and customer service strategies so you can constantly engage and earn referrals from primary care physicians will play a critical role. We'll chat about some of these as well. For both audiences, the importance of timeliness and communications in the referral process is essential. These are probably the two most important attributes of the referral process: timeliness and communications. How quickly do you get your patient into a specialist, and how quickly do you get them back, as well as the communications about that patient's status. This is what we hear from most referring physicians, as well as those receiving referrals, about what's most important. On the next slide, let's start talking about managing the referral continuum. Think of it this way as a cycle. The patient goes from primary care physician practice to a specialist, and sometimes more than one specialist, back to the primary care. So this is a cycle and a continuum that needs to be managed. And let's talk about best ways to do that. So what do primary care physicians value most? Well, certainly quality referrals and fast patient appointments from specialists is extremely important. If you think about a referral, it's an extension of the primary care physician's practice. So making that referral to a quality specialist who can get the patient in quickly to essentially assess the condition is extremely important. Timely communications on the patient's status, as well as discharge and follow-up information, is also very important in terms of what primary care physicians value most. They want to be able to get the patient in quickly, and they want to understand their status, and more importantly, what they can do when the patient comes back to their practice in terms of follow-up care. Primary care physicians want their patient back after a specialty service is referred. And this is something that obviously is so important for the specialist to understand as well. It's not an intention to, quote, keep the patient, but making sure that you encourage the patient to go back to their primary care physician is really where this really hits hard. And again, primary care physicians appreciate customer service. To specialists, they are your customers and they want acknowledgement, whether it's a thank you note, a phone call, whether it's an in-person visit, or a lunch or something to that effect, where you can get to know the primary care physician and again, express your gratitude. And importantly, primary care physicians want patient satisfaction and positive feedback. You're part of their care cycle, and this is obviously very important to them as well as the patient. Also, primary care physicians can be proactive about making referrals. So you can identify the patient conditions you see the most that require a referral. So instead of waiting until the patient needs a referral and then looking to see where should I refer, again, you can be proactive. What are those conditions? The chances are 80% of the conditions that you see are essentially the same and that require a referral. And understanding your case mix and your patient mix will be, again, the first step in that. Based on this, learn about specialists in your area who focus on these conditions. Maintain a list of them and their specialties. Manage the list, update it regularly based on patient satisfaction, feedback, and the outcomes that your patients essentially receive. And know when to refer patients for certain medical conditions. One of the complaints we hear often from specialists is that I didn't see the patient in time or soon enough. And from primary care physicians, I didn't know when I should refer the patient. So knowing when to refer patients for certain medical conditions is an important topic that you and your list of specialists that you refer to can discuss and again be well equipped to handle. What can specialists do to engage with primary care practices? Well, first, collaborate closely on patient care with the referring physicians. Primary care practices don't want to be left in the dark about their patient status. You can collaborate with the physicians and let them know exactly where their patient is in the process. Provide excellent customer service, and Mike will talk about this here shortly, with both referring physicians and don't forget referral coordinators, whether these are office administrators, physician liaisons, or other resources that practice has. Really understand the customer service, understand that these are your customers. Extend gratitude and appreciation for the referrals. Again, this helps build your practice. Be visible and proactive in thought leadership and online forums. Doximity, LinkedIn, your website, which we'll talk about shortly. These are all ways that you can essentially help to engage with primary care practices and be visible in your community. In addition, you can supply materials and articles to primary care practices that outline your areas of expertise, unique practices, advantages, and conditions that you regularly treat. Marketing materials can be done relatively inexpensively, sent via emails or other resources, so that the primary care practices always know how you're upgrading or updating your specialty practice. When possible, you can provide outcomes data and case reports that, again, showcase your expertise and your practice's success. These are meaningful to the primary care doctors. Share clinical guidelines that provide information on when to refer a patient. Again, we talked about some of the discontent about not knowing when to refer, how quickly to refer. So if you share those clinical guidelines that provide this information, they'll certainly go a long way with the primary care practices. And establish strong relationships. When possible, make in-person visits. If there's new practices in the area, send a welcome note or provide another gesture that acknowledges that they're new to the area and that you're there for them in the event they need to refer one of their patients. So these are all things you can do to engage primary care practices as a specialist. Importantly, know the 80-20 rule. So 80% of your referrals will more than likely stem from 20% of primary care practices in your area. So if you identify who they are and you develop a robust database, you can identify who these practices are and use them as your customer service gold standards. Don't forget, again, to identify practice gatekeepers as well within these practices. And you can develop a plan of action to maintain ongoing contacts with this important 20% physician base. Consider a CRM approach, customer relationship management if need be, so that you can track the number of times you make contact with these practices, the gestures you provide, the gratitude you show, and the number of patients that you receive. Certainly is a more advanced way to think about your primary care practice customers. Importantly, creating patient pull-through is right there as well. When a referral is made, or when a patient is told that they need to see a specialist, imagine if you're the name that they ask for. And what this does is most of the time, primary care practices will comply with this request. So again, if you maintain a strong online presence, you can establish confidence, trust, and this type of patient demand that ultimately will see that referral go to your practice. These are all advanced strategies to keep in mind. So what can all practices do to bolster their referral business? This gets back to that patient-centric referral strategy, keeping the patient front and center and being transparent with them. So first, again, as we talked about in the early primers in the Footsteps program, is identify and amplify your practice's unique marketing advantage. Make sure that it's well known what you do and what you do well. Create a strong online presence. Optimize your website so patients and prospective referring physicians will find it easily. Share articles and other forms of thought leadership. Include positive patient reviews and testimonials. Use social media to share important information about your practice, the locations, the languages you provide, and other insights, again, that make your practice special and unique. And these are all things you can do so patients will have an opportunity to know your practice before a referral is made, or to know it better when they are in fact referred to your practice. So now I'd like to turn it over to Mike. We talked a lot about customer service and how important it is. I'd like Mike to kind of embellish on these strategies for all practices. Mike?
Great. Thank you, Rob. Yes, I want to spend some time going over some specifics when it comes to customer service strategies and how they can help enhance referral relationships. Keep in mind the 4 C's of customer service: communications, credibility, capacity, and consistency. For communications, determine the frequency of outreach and contact. How often do you want to send a referral source a piece of communication, and in what form? Identify special needs based opportunities for referring physicians. Has there been an event? Has there been a disease, a development, whatever it is that makes referrals to your practice even more valuable? Now, things, as Rob mentioned, that are going to be must-haves for referral sources, they need patient status, they need discharge information, and they need, or maybe more specifically, appreciate thank yous and follow-ups. What you'll need to be able to provide are marketing materials. What's unique about your practice, background on yourself or the other providers in your practice, contact information, regular business hours. How do you get a hold of someone to refer a patient if there's an emergency? Other important information, forms and business cards are things that you're going to want to make sure the referral sources have. Is, in essence, make sure that they understand all of the reasons to refer to you or to your practice. Credibility. This is just as important for the patient as the referring physician. They need to feel both trust and confidence in you as a referral or as a referral source. Assume that the first thing a patient who's referred to your practice is going to do is Google you and check you out online. You want to make sure that you maintain content and thought leadership strategies on your website, as Rob had mentioned. Something to pay special attention to is online reputation and presence. This needs to be monitored constantly. There are ways that you can enhance patient reviews. Reviews tend to be a source that many patients use to make decisions when it comes to certain healthcare providers and whether that's the healthcare provider for them. So make sure that you encourage your patients to provide positive reviews and monitor always. You want to make sure you share relevant clinical updates, research reports. Again, this could be in hard copy form to referral sources. You could email it to them. You certainly should have it on your website. And always be transparent with patient outcomes. Next is capacity. The number one issue is often, how quickly can you see my patient? Flexibility with urgent and emergent cases is also key. You want to make sure in your personal communications with referral sources that they understand how to get someone in that needs to be seen immediately. Making sure your referral protocols are easy is key. You want to make sure that you communicate that this is how you make a referral, this is who you contact, this is the number, this is how you reach me if it's outside of business hours, etc. You also want to state how your practice addresses social determinants. So that could be access to your location via public transit. It could be languages that are spoken at your practice or access to translators. It can also often be payment options, insurance coverage, etc. But many may choose to pay directly by cash, and having a plan for that type of a payment is important to communicate. Next is consistency. Again, establish customer service strategies, referral protocols, and set a schedule for regular contacts and outreach. This could include things like relevant holiday gifts or outreach. It could be patient visits, information. But when it comes to referrals, set guidelines. Keep them every time, with every interaction, with every referrer and every patient. All right, back to you, Rob.
Great, thanks, Mike. Excellent tips on customer service. Let's talk about the importance of online strategies to bolster your referrals. And again, in the Steps Forward program, there have been several primers dedicated to this topic, both from a basic and advanced standpoint. So I do encourage you to go back online and check these resources out. But I do want to just cover some of the basics again as it pertains to referral sources. So as Mike said, the first place a referring physician and or patient often will go to review the specialist or even vice versa is the website. So making sure that your website content is up to date. Make sure your biography or your CVs are up to date about your qualifications, the specialties, background experience, not only for the physicians, but also all providers who may see a patient in their practice. Back to the unique competitive differentiator. This is, again, one of the early primers on identifying your marketing advantage. What's important on your website is to showcase what you do and what you do well, whether it's cutting-edge technology, exceptional patient care, or another attribute that will help attract referring physicians who are seeking specific services. So really important to look at your website and make sure that it captures the essence of your practice and what's going to make it a viable option for either a referring physician or a patient. Other practice information, as we talked about, whether it's languages spoken, office hours, other affiliations, services offers, and so forth, are all things you can do to your website content. In addition, if there's other physician reviews or reviews on your practice, as well as testimonials as referenced, these can certainly build trust and credibility and reassure potential referrers and patients about the quality of care and the positive experiences that have been shared by other patients. So certainly an opportunity to bolster your website with this. In addition, whether it's blog posts that you're writing, links to news features, or other media coverage, again, all of this showcase your practice's expertise, innovation, and patient engagement So when a referring physician or patient are looking up your practice, you're going to come across as an authority and as an expert and as a thought leader in these areas that are relevant to your practice. So I'm going to talk a little bit about managing your online reputation. And again, this goes back to the earlier primer that was done, but worthwhile to repeat some of the key aspects of it. Online reputation is the perception and image of a doctor or healthcare provider as portrayed through online channels such as third-party review sites and other online platforms. Significant to keep your reputation up on this and to recognize the important role it plays. Potential patients and referral sources rely on these online reviews to make decisions about choosing a healthcare provider. And a positive online reputation will help you build trust and attract more patients, enhance your credibility. Of course, conversely, a negative online reputation may deter patients and impact your overall practice. So managing that online reputation, again, critical to your referral success. I want to talk now, or I want Mike to chat a little bit about other sources for professional referrals. They don't always rely on other physician practices. In fact, there's many in your community that your practice will benefit from. Mike?
Great, thanks, Rob. I want to talk a little bit about some specific audiences that you can target for referrals. To target those who do not have a primary care physician, engage urgent care, emergency rooms, specialists, and subspecialists. Start with introductory meetings with the medical staff and the directors. Make sure that you emphasize the patient-centric and collaborative care that you provide. This will build trust, as has been discussed earlier. You also want to make sure that the lines of communication are open between yourself and these different facilities or entities, that health updates, follow-ups can go back and forth both ways. If possible, provide a practice display or a poster, or at a very minimum, make sure that you have capabilities collateral or a brochure available that can be handed out to patients in need. To target more at-risk populations, engage local businesses and community centers. Again, this starts with an introductory meeting with any on-site medical staff, if available, and/or in many cases, HR. You want to understand any location-based health needs. Now, this could be an employees that do certain tasks that are now facing certain health issues or injuries. How can you help prevent those injuries? It could be those who use a community center and consistent needs that they have, things that you can help the community center identify as reasons to refer to a physician. Offer to conduct free on-site health screenings. These can be very effective and low risk to either an employer or a community center. You want to be able to get in there, assess what's going on with employees, with those who use community centers, and see how you can help and how a referral to your practice will help the overall health of these individuals. You want to make sure you provide health tips and resources, both printed that a business or a community center can hand out, or certainly make sure that they're online on your website. Again, you want to make sure that they have your capabilities collateral. So if there is an employee or someone in need of your services, they know how to contact you and they know the robustness of your practice. To target vulnerable populations or the underserved, a good place to start is by engaging schools, and in particular school nurses. They tend to be the front line when it comes to the health of a family that is maybe new to the area. Again, introductory meetings with school administrators and nurses is going to be a place to start. You want to make sure that you're a valuable resource. So provide guides for conditions that are trending. Make sure that, again, they understand when a certain condition might require a physician visit. Provide ongoing communications for shifts in disease presentation or health updates. Perfect example is as we've all gone through COVID and follow up and back to work, back to school, providing those updates to schools is very, very important. Again, make sure that the schools have your capabilities collateral that explains how to refer or how they can access your practice. In terms of health or social service agencies, again, introductory meetings with administration, in this case, caseworkers. Again, make sure that they understand what your practice is all about, how you can serve this population, make sure they have your capabilities collateral, and address and make it clear how your practice works within the social determinants of health. Again, as was stated earlier, often this can be related to something as simple as, how do I pay for my visit? Lastly, don't forget community engagement. Attend medical conferences, network, join both national and local medical association chapters. But important to get out there in the community, volunteer at community events, participate in health fairs with other providers. For example, you can engage your local chamber of commerce, join, figure out how you can help them help the population that the chamber of commerce serves. Set up a table at a farmer's market or other community event, but most importantly, get out there.
Great. Well, thank you for joining us today. We hope that this discussion on advanced referral strategies is helpful to you and your practice to build the relationships and to ultimately achieve greater patient volume and consistency. Thanks again for joining us.
That concludes today's webinar. Thank you to our speakers for sharing their time with us today. We encourage you to check out the discussion board to connect with Rob, Mike, and other participants, and their office hours are listed on the slide below. We also encourage you to check out the Steps Forward website for any additional resources or frequently asked questions. Thank you.